Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight, a webinar where we're going to talk about Lyme disease. I look forward to seeing what you have in store for me tonight with your questions. For those of you that are new here, welcome. Get to participate in this webinar two ways. One is you can write questions to me, and you can do that through the chat box in the lower right-hand side of your screen, it is. You can write a question to me using that chat box. The only thing I ask is that you write short questions because this format works out best for short questions, not long ones. Second thing is do not hit the enter key until you've written the complete question. Each time that you hit the enter key, it actually sends a separate question my direction. Okay, so I'd request that as well too. For those of you that are back here again, welcome back too. I see a number of familiar names on my message board this evening. So tonight we'll get through as many questions as I possibly can. I usually am unable to get through all of them, but we'll see how that goes this evening, okay? And then tomorrow morning, keep an eye out at your email because I am creating a recording of tonight's webinar. So if you happen to miss anything, I will send out an email tomorrow morning, which will have a summary of what we talked about tonight, as well as a link to the recording of the webinar tonight as well, too. In that email message tomorrow, you can also sign up for the next webinar, okay? And as many of you know, there was some confusion with my webinar host about the start time that they had on the screen. I think we've ironed that out for next week, so it'll actually say it's a 4 o'clock start time. I think I had warned you about that in the email I sent out where everyone signed up, but I should have that worked out. Hopefully we have that worked out for next week as well, too, all right? So during the webinar tonight, I will read the questions out loud, but for those of you that are participating here in the live version, you'll actually be able to see them on your screen. So you'll be able to read them along with me too, okay? All right. So without any further ado, let's go ahead and get started here. All right, first question is from Andrea. Hi, Dr. Ross. What do you recommend for an overactive immune system? I'm constantly having inflammatory responses even after 2 years of treating. Every few days, it feels like I have the flu along with chronic neck pain. Is it possible my body still thinks that I have an infection even if I don't? So, Andrea, I'll make a few observations. I would need to probably ask you a number of questions to figure out what's triggering it in your situation, okay? So inflammation in the body when you've had Lyme or have had tick-borne infections usually is due to the white blood cells overproducing a group of chemicals called cytokines, okay? So cytokines are manufactured by white blood cells when they see infection and when they see mold toxins in you. And they will make these cytokines for one good reason. That is, the cytokines help turn the immune system on. But if they're made in excess, they can give you inflammation, they can give you fatigue, difficulty thinking, body pain. All those symptoms we call Lyme symptoms are really from too many cytokines, all right? Now, if you've been treated for Lyme and your Lyme infection is gone, and I'm not quite sure how you've determined your Lyme infection is gone, but if your Lyme infection is gone from having treated Lyme, then an ongoing reason you might still be making cytokines and be inflamed is from having used prescription and herbal antibiotics, you might have a condition where you've got too many yeast sitting in your intestines because too many yeast in the intestines also promote increased cytokine production. Okay, so my first place I would start, and if I were questioning you, I'd be asking you a lot of questions to find out, is there anything suggesting too many yeast in your intestines? So symptoms that make me think of yeast overgrowth are I'm still staying inflamed even after you've been treated for a while. Number two, second thing is do you have increased sugar cravings? If you're a woman, do you tend to get a lot of vaginal itching, vaginal discharges? Also, if you have too many yeast in the intestines, they lead to toxins being produced by the yeast. Those toxins can interact with your skin, leading to pimples and acne or skin rashes, okay? So those are some things to think about. The other thing that can have happened that you could look at with your providers is sometimes having had chronic infection or having ongoing mold toxicity issues can trigger your a hyperreactivity of the immune system or hyperreactivity of what are known as mast cells. So mast cells are the cells that we typically have thought of as being allergy cells, they're the cells that where histamines are made. And when something we're allergic to lands on them, they make histamines. But they also, if you have infection or mold, they can be turned on to overmake histamines. And when they're turned on, or if you develop a lot of allergies, these cells also produce cytokines. Okay, so the other thing to look at is, are you a person that might have mast cell activation triggered by infections? Okay, and then the third thing I would look at is, are your tick-borne infections really gone? The kind of symptoms you're describing make me wonder about that. Okay, all right, so I'm going to do a quick screen share here to show you a few things that you can take a look at. All right, so this is my Lyme information site, Treat Lyme by Marty Ross MD. Regarding trying to figure out if you have too many yeast in your intestines, take a look at my yeast section here. And then this article called A Silent Problem, Is It Yeast? Click on that. In there, you'll find questions you can ask to figure out if it is too many yeast. And also there's a questionnaire I use sometimes as well too, okay? And if you do have too many yeast, take a look at my article over here about what do you do about them. It's called Kills Yeast, A Brief Guide, okay? And then in terms of mast cell activation syndrome, or mast cell activation and mast cell activation syndrome, take a look in my immune system section here. And then take a look at this article called Mast Cell Activation Syndrome and Lyme, okay? All right. So anyhow, those are a few thoughts for you, okay? Again, I wish I could give you more of a direct response. Again, I would need to know more specifically about your situation. There we go. All right. Good luck to you, Andrea. Hello, SK. Let's see, Dr. Ross, what would you recommend to someone who got complications, heart issues, etc., after the Pfizer injection? I've heard rumors about trying glutathione. Some say to use bromelain and papain for the spike protein. Any wisdom you have to offer will be appreciated. Thanks. Also, do you recommend IGenex or Galaxy Diagnostics for comprehensive tick-borne testing? Okay, so let me start with the last part of that question. And then I'll move to the first part. Okay, so regarding my favorite lab and to do tick-borne testing, and by tick-borne testing, I mean testing for Bartonella, Borrelia, which is Lyme, Anaplasma, Ehrlichia, those infections, okay, those 4 infections, Babesia, I think I said Bartonella. Anyhow, I like IGenex. I prefer IGenex over Galaxy. So IGenex, I think, has done a better job of perfecting Lyme testing. Their Lyme test, which the Lyme test I would use out of IGenex is their Lyme immunoblot, is going to be looks to see if you have antibodies against 8 strains of Lyme versus the Western blot method that I think that's being used by Galaxy is only looking to see if you have antibodies against, I think, 1 or 2 strains. So it's not looking for as many strains, okay? For Bartonella testing, the test that is being done out of IGenex, the primary one would be their IGenex Bartonella immunoblot, and it's looking to see if you have antibodies that are made against 15, the family that includes 15 kinds of Bartonella that can infect a person. And in addition, they can identify antibodies against 4 of those specific 15 strains, okay? I prefer that over the Galaxy test. Galaxy does an IFA, which is an antibody test against 2 strains of Bartonella, Bartonella henselae, and Bartonella cantana. In addition, Galaxy does a enhanced PCR, or a test to see if there's the DNA of the germ in your blood for Bartonella against all 15 strains that I already talked about. The trouble is, Bartonella often doesn't live in the blood. So although Galaxy has a good test if it can be found in the blood, the issue is, in terms of it being a test that's adequate to find it, is not. We don't know. They haven't even ever been able to do studies that prove how often they can find Bartonella when it's there. Okay, working with the immunoblot method that IGenex does for Bartonella, I'm finding their validation studies suggest it can find Bartonella when it's there about 90% of the time. I'm seeing a similar story here in my practice as well too. Okay, then In terms of anaplasma and Ehrlichia, I'm not even sure if what Galaxy is doing for those. I would suspect is an antibody test. It's going to be similar in effectiveness to an antibody test that would be done by IGenex for those. Okay. And then finally, for Babesia, the lab that does the most extensive testing technique for that would be IGenex, more extensive than what you would see out of Galaxy. And IGenex has a test to look and see if you have antibodies against two strains of Babesia microti and Babesia decani. I blanked there for a minute. In addition, what IGenex does is another test, which is a microscope exam called a FISH test, a fluorescent in situ hybridization test, a FISH test, which basically takes a fluorescing agent and sticks it on your Babesia germs to see if you can see it under the microscope. And that test is looking to see it's a test to look against the genus of Babesia, meaning it can detect Babesia of all strains potentially. Okay, and I find that to be a more useful test than just doing antibody testing alone. All right. So although I know that IGenex can be one of the more spendy labs, it is the best lab. You get what you pay for. And when you're trying to figure out if you have tick-borne infections, you want to go with a lab that has a better way of seeing if it's even there. Okay. And I think across the board, I would choose IGenex over a Galaxy. I would choose an IGenex definitely over Vibrant Labs. I would choose IGenex over DNA Connections, and I don't even know what DNA Connections is testing for because they've never validated their studies. I know what they're testing for, but they don't have adequate validation studies to show that their technique even works, okay? IGenex is your better lab to go with, okay? All right, so having said that, and no, I don't receive any money from IGenex for this. This is based on my clinical experience working, okay? All right, then, in terms of what's happening with post any one of bad outcomes that we might see with the Pfizer or with the Moderna injections, it's still a lot of guessing as to why people have these ongoing problems. All right, we don't know for sure. All right, there is some research suggesting, though, that the spike protein, which is these vaccines turn your cells on to produce this thing called the spike protein, that spike protein in some people is hard for their immune systems to clear, and that your monocytes, which are types of white blood cells that are supposed to get rid of them, aren't getting rid of them quickly in some people, although over time they do, okay? So one of the things I would say, and so having those spike proteins sitting there inside your monocytes can lead to ongoing inflammation, which is cytokine inflammation, all right? So one thing is it's just going to take time. Most of these things that people are being left with, the rare people that have, and I want to clarify, most people are not left with anything that's ongoing from getting the COVID vaccine. There's a rare group that does, okay? In the rare group that it does, what I see in my practice is it's a matter of time. Usually over about a 6-month period of time, most of these problems go away. They seem to resolve, okay? But in terms of helping a person get through them, I tend to focus on giving things that are anti-cytokine, all right? Because having this spike protein sitting around and not being cleared by your monocytes triggers more ongoing cytokine inflammation, basically. And I talked about cytokines earlier tonight, okay? So the two things I like to do is, number one, I like to work with curcumin. Curcumin is a component of the Indian seasoning turmeric. It does a good job of getting inside white blood cells and kind of turning down their ability to make cytokines, okay? It literally interrupts some of the production line, okay? So I like using a liposomal variety of curcumin. That's a product made by Thorne called Mariva 500. I would have a person take anywhere from 500 milligrams 3 times a day up to 1,000 milligrams 3 times a day, okay? Second thing I like to do is to use glutathione, which you mentioned here. And you can either do it as IV infusions or short-term injections. And if you were to do it that way, I would dose at about 2,500 milligrams IV given over about 10 minutes 2 times a week. Or you can do it orally. But if you're going to do it orally, you want to make sure that you're using a variety that can be well absorbed, all right? And there are only a handful of products out there that have proven track records of good absorption. One of those is a product made by Research Nutritionals called Trifortify. the Trifortify orange and Trifortify watermelon that they have. They've done studies, Research Nutritionals has studied them to look at what happens with red blood cell levels of glutathione when somebody takes this oral agent, and they get marked increases in red blood cell levels. Okay, so they've researched it to say, does our way that we prepare the glutathione, does it really result in adequate absorption? Guess what? It does. All right. So the Trifortify product is a liposomal, microscopically wrapped in fat preparation. And I usually, for moderate cases, I would do a teaspoonful one time a day. For more severe cases, I might do a teaspoonful twice a day instead of as an alternative to doing the IV glutathione. Okay. But most of this stuff, you just have to give it time. It's just a matter of time, unfortunately. Okay. All right. Good luck to you, SK. Hello, Gail. Let's see, hi, Dr. Ross. I took selenium by thorn and inositol religiously for 3 months as my TSH was 4.87 on July 9th. It historically has been in the 2.0, so this was a sudden change. I do have positive TPO antibodies and have for at least 15 years, but my thyroid levels have always been fine. Now, my recent labs show it has gone up to 7.120. So it would appear the selenium and inositol didn't work. My T4 is, my free T4 is 0.9, reverse T3 is 12.5, and T3 is 3.1. So everyone, those thyroid levels, the T3 and the T4, which are the two kinds of thyroid that are made, are in normal range. Reverse T3 is a chemical that can develop if you are not converting the T4 that is made by the thyroid into T3. It's supposed to be. But if you're not able to do it, you'll develop a lot of reverse T3, and that's normal as well, too. So your actual thyroid levels are good, but what that increased TSH tells me is that your brain is saying that even though the thyroid numbers are normal, that you probably would do better at higher thyroid levels than what your labs indicate. Okay, so high TSH means the brain is yelling at your thyroid to make more thyroid. Okay, the brain is thinking you don't have enough thyroid, and so it makes higher amounts of TSH, which is a chemical the brain uses to communicate with your thyroid gland to make thyroid. All right. Okay. Now, and TPO antibodies are something that are elevated if somebody has an autoimmune condition of their thyroid called Hashimoto's thyroiditis. Okay. Now, Gail, I'm going to read the rest of your question here in a minute, but I want to make a comment. So the thing about Hashimoto's thyroiditis, which is inflammation of your thyroid, is that the course of the illness, if it goes unchecked, is that over time, you will eventually become more hypothyroid. It's a natural course of the illness. So even though you're doing things, you just may be seeing a natural progression of the illness, unfortunately. Okay. I'll probably have some other ideas for you, but I just want to let you know that. Okay. All right. Let's see. Let me go on here. My LLND wanted me to start Armour Thyroid 15 milligrams 1 time a day back in July, but I wanted to try selenium and inositol first. The thing is, I don't think I have any symptoms of hypothyroidism. I think it's still subclinical. Number 1, does liquid potassium iodide work for Hashimoto's induced hypothyroidism? I've heard it does. It does not. Should I try it? And if so, what brand and dose? So I've never seen any evidence saying that potassium is the way you would approach this. And I've studied it. I haven't seen anything that says that. Okay. Number 2, if I were your patient, what would you do? And number 3, what are the benefits, drawbacks of Armour Thyroid over synthroid? You have a ton of info on your website, but it's all a bit confusing. Okay, so let's number 2. So my approach for my patients that have elevated TPO antibodies, elevated TSH, meaning the brain doesn't think you're getting enough thyroid, and even if they have normal thyroid levels, is I try to do a few things. Number 1, I work with ashwagandha. It's an herbal medicine. It's an herb that is an adaptogen. It's been used historically in Chinese and in Ayurvedic medicine because it's been observed to give people more energy when they're under stress. Okay. Animal studies tell us that it causes better thyroid production and it helps the adrenal glands work better. Okay, so I would start a person, if in my practice that has a picture like this, I would get them on ashwagandha, 400 to 500 milligram pills, and I would do 2 pills in the morning and 2 pills between 1 and 2. And that's to promote better thyroid function. Okay, all right. Number 2, I would be on selenium, about 200 micrograms a day. Number 3, I might get on some iodine, and I'll show you an article where we can look at I'm blanking on the amount of it. So I would do that. Okay. The other thing I would do, because Hashimoto's is an autoimmune illness, is I would try to regulate the immune system attacking the thyroid gland. And to do that, I would work with low-dose naltrexone. You may have heard me mention that before, those of you that have participated before, but naltrexone is a narcotic blocker. Okay, it's used for people that have drug overdoses. So, but what it does here is we have a type of narcotic chemical that our bodies naturally make called endorphins, all right? And the endorphins that we make have endorphin receptors. And those endorphins help regulate pain in our body, but they also regulate the immune system, all right? And if we do a temporary blockade of endorphin receptors with naltrexone, it causes those endorphin receptors to be more responsive to the existing endorphins that are around. And then when that blockade wears off after about 4 to 6 hours of using naltrexone, these receptors now are more sensitive to endorphins, but the brain has also been sending out signals during the blockade to cause the body to make more endorphins. So when the LDN goes away, there's more endorphins around, and the endorphin receptors are more sensitive, and they get flooded with all these extra endorphins. And that has an effect of turning down autoimmune reactions, okay? The way you dose low-dose naltrexone is you start at 1.5 milligrams a day, and then over 2 weeks, you increase it to 3 milligrams, and then 2 weeks later, you increase it to 4.5 milligrams. It has to be made by a compounding pharmacy, all right? Now, that's the approach I generally will use to support the thyroid in somebody that has autoimmune Hashimoto's thyroid illness, okay? Now, if I've done that and they still are showing increasing TSH and they are showing lower numbers of thyroid, then I will start thyroid medication. And what I like using for thyroid medication, my preference would be to start with armour thyroid versus the levothyroxine or synthroid that you're talking about. Okay, now why would I do that? All right, so your thyroid gland up here in the neck makes a balance of T4 and T3, and roughly about 90% of your thyroid gland, about 90% of what's produced by the thyroid gland is T4, and about 10% is T3, okay? All right. Now what happens with that T4 and the T3 is it gets in your blood, goes out to the tissues, and inside the cells, that T4 is all converted into T3. All right. Armour thyroid is ground up thyroid gland from either beef or pork, depending on what your source is. And it is a mix of T4 and T3. It tends to have more T3 than what our thyroid glands do, but still it's a mix of T4 and T3. So I tend to want to use that because I'm trying to mirror more what the thyroid normally would make, versus levothyroxine synthroid is only T4 by itself. All right. I just find better clinical response in somebody using the armour thyroid, basically. Okay. All right. So let me just do a quick screen share here. I want to show you the article I've written about this. All right, so it's a pretty extensive article that I wrote. It actually is something I had to write in response to the medical board being concerned about how I was managing thyroid in my practice. And this is what I sent them. And I didn't hear any more from them after I sent this to them. So anyhow, this is... So in terms of the thing, so I do mention that. Okay, so we talk about selenium. I mentioned it here. The other thing is the low-dose naltrexone. I talk about it here. And then, hold on here a minute. I even talk about the thyroid hormones up above. Now, bear with me. I'm trying to get down here. Okay, that's right. So in addition to using selenium, zinc and vitamin D and iodine are helpful. Okay, that's what I was blanking on that. I needed to look it up. So you want to do your, so as I said, use ashwagandha. Okay, but then also I would be working with and do your, and then do the low dose naltrexone. Your selenium should be at 200 micrograms a day, zinc at 15 to 30 milligrams a day. And you want to keep your vitamin D levels so that they're between 50 and 80, basically. Okay. Yeah. So anyhow, and so here's some information you can look at regarding that too. Okay. All right. So I hope that gives you enough information. All right. Good luck to you, Gal. So Gal, just to summarize, I want to make sure I don't leave you in confusion. I think my first step, given where you've been here already, is you might still want to give some consideration of trying low-dose naltrexone if you haven't done it. You might want to get on some vitamin D if your levels are low. You might want to add some zinc in as well too, and try ashwagandha. Give it a try for about 3 months, 4 months. If that's not working well enough, then you may want to consider adding in some armour thyroid. Okay, all right. But again, work with your naturopathic doctor on that. Okay, all right. Thanks for that question. Let's see. Joyce says, hi, Dr. Ross. Hello, Joyce. And Amanda says the same thing. Hello, Amanda. This next question is from Lynn. Hi, Lynn. Let's see how Dr. Ross. A family member was diagnosed with RBD, REM behavior disorder, which often leads to Parkinson's. Could this be Lyme related? And are there supplements or other interventions that can be used to try to prevent neurodegenerative disorders like Parkinson's? Also, she sent off all her herbal meds. Let's see. Also, I'm not sure what you're saying here. Something off all her herbal meds, Houttania, Cinnamon, cinnamon, clove, oregano oil, cat's claw, toba bark, knotweed, to get the vaccine. She wants to get the Bartonella and Lyme test you recommend from IGenex. Would it be better for her to test while she's still off the supplements, or should she do so after she starts the supplements? Okay, so if you're doing antibody testing for Lyme, like the Lyme immunoblot and the Bartonella immunoblot that I talked about, you probably can even get a better outcome, have a better chance of getting positive if you actually are killing germs at the same time, okay? Because when you're killing germs with your herbal antibiotics that she's off of right now, as you kill them, that releases more dead bug parts, if you will, into the bloodstream where the immune system has an easier time seeing the germs and will have a stronger antibody reaction, okay? So it's okay to be on those. So if you're trying to do, that's called a way of provoking a positive antibody reaction for the immunoblots test that I've been talking about tonight. Usually for about 3 weeks or so, you want to be on those before you do the testing if you're trying to promote that positive test, okay? In terms of the REM behavior disorder and whether it's triggered by Lyme or not, I haven't seen any information about that. I honestly don't know. I know Parkinson's, there are a sector, a small percentage of patients that get Parkinson's that it is Lyme that causes it. That's not all people with Parkinson's, okay? So I'm afraid I just don't have a good response for you on that one. All right. Thanks, Lynn. Good luck to you. Hello, Betty. Let's see. Do you ever see elevated insulin or insulin resistance? I haven't seen Lyme give elevated insulin or cause insulin resistance, if that's what you're asking. Okay. Thanks for that question. Hello, Thomas. Let's see. What are the signs of malabsorption? Are there anything you can do about it? So malabsorption or poor nutrition, I mean, in an extreme sense, would give people like really distended abdomens, for instance. They'll have muscle wasting. You can have thinning of the skin. That would be in an extreme situation where somebody's not getting enough nutrients absorbed. Sometimes if people are having poor absorption, you will see food remnants in the toilet when you go to the bathroom. That's another thing you can look at, okay? Blood testing, if somebody has got malabsorption, will usually start showing some problems with proteins. And the ones that's most sensitive to what you eat in your food would be something called albumin. You'll start seeing some deficiencies in albumin. If you've got a poor fat absorption, you might start seeing problems with cholesterol and hormones like estrogen, progesterone, testosterone that are fat dependent. And with poor absorption, you might start seeing some problems with functioning of the liver and kidneys. And so you might see some abnormal kidney liver function testing as well, too. Okay. Those would be some things to think about. But you've seen like the really malnourished children in Africa, for instance, where they have the really distended bellies and the muscles look really thin and the thin looks skinned out. That's what malabsorption in an extreme situation would look like. Okay. All right. Thanks, Thomas. Hello, Carl. Let's see. Do you ever see secondary infections such as psoriasis and eczema, which seem to be autoimmune? So to answer your question, psoriasis and eczema are not infections, okay? But they're conditions. So do I see secondary conditions like psoriasis and eczema that can flare up in tick-borne illnesses? Yeah, I somehow have seen psoriasis and eczema get worse. I tend to see that, though, usually more when somebody that I'm treating for tick-borne infections develops secondary overgrowth of yeast in their intestines. And getting too many yeast in the intestines can trigger psoriasis flares and can trigger eczema to get worse as well, too. Okay? All right. So earlier tonight, I showed everyone the articles I've written about how to determine if you have too many yeast and what to do about it. You'll find those in my yeast section at treatlyme.net. which is the Treat Lyme by Marty Ross MD. Okay? All right. Thanks for the question, Carl. Good luck to you. Hello, Joyce. Let's say hi, Dr. Ross. Hope you enjoyed your Thanksgiving travels. I did. Thank you very much. Actually, I was here in town, in and around the area, I should say. Please discuss the impact of Epstein-Barr virus on the thyroid and its role in Lyme symptoms, as well as the best way to address this. So first of all, I tend to fall in a different camp than a lot of my colleagues on Epstein-Barr. So Epstein-Barr and here's why. So Epstein-Barr is a common virus that is found in healthy people. All right. So I know a lot of my colleagues will do Epstein-Barr antibody testing and they see elevated antibodies and they automatically say, look, your Epstein-Barr virus has gotten active. It's part of the problem. And what I want to say to them is, how do we know it's part of the problem? Right? Because Epstein-Barr virus is found, elevated antibodies to Epstein-Barr virus is found in healthy people too. Because Epstein-Barr virus is a common virus that can live in us and cohabitate with us, all right? So if you were to pull a bunch of like 100 healthy people off the street, we might find elevated Epstein-Barr virus antibody levels or titers in, say, about 10 or 20% of those healthy people. But they're healthy, all right? So having elevated antibodies does not mean your immune system is that the virus load has actually become increased. Sometimes having elevated antibodies against a virus may mean your immune system is doing a good job doing what it's supposed to do, which is keeping those germs under control. All right. So I totally disagree with my colleagues that chase after Epstein-Barr right away. I just do. All right. Now, in my practice, what I do is I want to try to see if somebody, what I'll usually do is if I've got I'm not even worried. I don't even go looking for chronic virus infections until maybe 9 months or so into an treating Lyme. And I will start looking to see if somebody might have reactivated chronic viruses only after we've spent about 9 months trying to get Lyme and co-infections under control. Because first of all, we don't have the strongest way of knowing, are they really out of control? Again, because antibody testing is not reliable. All you know from antibody testing is that you've had the germ in you, and your immune system may just be doing a good job keeping it under control, even if those antibody levels are elevated, okay? That may be what's going on. And I also believe that even if somebody does get activated Epstein-Barr or activated herpes virus or activated cytomegalovirus, that the way to get that activated virus under control is get the immune system working better. And the way to do that is to get your tick-borne infections under control. All right, so I'm going to spend my efforts in the first 9 months of treatment getting the tick-borne infections under control. And as many of you know from my Ross Lyme support protocol, I also do a lot of things in there that are designed to help the immune system work better, like getting sleep. Number 2, lowering cytokines, because if you lower cytokines, your immune system will work better. Number 3, being on ashwagandha to help the body's adapt with stress and get the immune system working better. Number 4, get yeast out. Number 5, treat your Lyme, your Bartonella, and your Babesia, get those infections under control. Number 6, be on a good multivitamin. Number 7, work on things that help with detoxification. Okay, so all these things are designed to get your immune system working better to put the viruses under control. All right, now, if I'm about 9 months into treatment and somebody's not getting better, what I'm going to do to see if we have chronic virus problems is actually to do a test called a Nagalase test. And what a Nagalase test is it's an enzyme that is made in the skin of viruses, and its purpose is to make it so that a type of white blood cell called a macrophage that's supposed to fight viruses, it's what this Nagalase does is it makes it so they can't be activated. They can't be turned on. Specifically, what it does is this Nagalase breaks a sugar group off of a chemical called macrophage activating factor. And if the macrophage activating factor doesn't work correctly because it has a sugar group broken off of it, guess what doesn't get turned on? Your macrophages, okay? So if you have marked elevations of Nagalase, what it says is you've got high virus loads in you. It doesn't tell you, though, which viruses. It says high virus loads. So my approach then with somebody that has high Nagalase levels is to get people on antiviral regimens. And what I like using is something that's going to target most elevated viruses. That is, I like using olive leaf extract, working up to 1,500 milligrams 3 times a day. I like also having people on reishi mushrooms, 400 milligrams 3 times a day, because that turns on antiviral parts of your immune system to work better too, okay? I'll show you an article where I've written a lot about Nagalase and what do you do about chronic virus infections here in a minute, okay? Now back to your question, does this impact the thyroid? So any infection that is in you that is out of control will trigger more cytokines. I mentioned cytokines earlier tonight, right? And those increased cytokines can lead to thyroid dysfunction. So that's the impact that it would be, okay? All right. So let me just show you my article about viral infections and Nagalase testing and all that so you can look at that later, okay? All right. So let's see here. Type Nagalase. All right. So, oops, let me get rid of that one actually. All right. So this is my article called When and How to Treat Chronic Viruses in Lyme. Okay. Basically, it's 9 months or later into the infection, you start looking to see if you really even have a problem. I talk about the problems with IgG antibody levels that I was telling you about, that they really don't reflect true virus load. I prefer doing this test called a Nagalase. And then I talk about the approaches I take, which is primarily using olive leaf, reishi mushrooms. You can use transfer factors as well, too. I talk about how to dose everything down here, okay? And I generally do not use prescription medicines for viruses, okay? All right. All right. Good luck to you, Joyce. Thanks for that question. Hello, Brandy. Let's see. What are some of the signs the thyroid is not working correctly? It's a good question. So symptoms of low thyroid can be low energy. Okay, but there's a lot of things that can give you low energy, but one of the symptoms is low energy. A second one of low thyroid can be slow knee reflexes or slow elbow reflexes. Okay, dry skin, weight gain, and cold intolerance. By cold intolerance, I mean the person that has to have many more layers to stay comfortable in a room when everyone else isn't wearing many layers. Okay, that could even be in air conditioning, for instance, too. Okay, so those are some of the things that I will look for to help me understand if somebody might have low thyroid. Okay, so dry skin, cold intolerance, weight gain, low energy. I had to think about that for a minute. Okay, thanks, Brandy. Good luck to you. Hello, Justin. Let's see. Do you ever see other issues crop up in the weakened state, such as impetigo or shingles? I haven't seen impetigo show up. I know that some of my patients get shingles, but they tend to be my patients that are also older. So as we know, people over age 55 have an increased risk of having reactivated chickenpox, which is what shingles is, okay? And so that increases every year after age 55. The people I tend to see get shingles are in the elderly group. By elderly, I mean over 55, so I just threw myself in that group too. But in older elderly people, especially when you get in your 60s and 70s, that's when we start seeing more reactivation of chickenpox as shingles, if you will. And I don't think it's related to Lyme, actually. I tend not to see that. I think it's more related to age. Okay. Right. Thanks for that question. Hello, Amanda. Hold on here just a minute. Let's see. Thank you for putting together these events. I have been exposed to several types of mold, and we also used real time to figure out what is going on inside our bodies from all this different types of mold exposure. You got another part to your question here. Just a minute, Amanda. Let's see. Here's the second part. Let's see. We're about 1.5 months into treatment, and my hair is falling out in massive amounts. My skin is bright red again, and I'm having tremendous neurologic response midway. To be frank, I'm scared. I'm scared I could be facing cancer from so much prolonged exposure. And now my body, while going to treatment, is all fine and dandy, but I'm still having these symptoms, and some of the symptoms are actually new, such as the hair loss. So in a matter, I would say, of 7 days, I've lost maybe half my head of hair. So it's very concerning, I also have the Bartonella, and the Borrelia and the POTS. I've also tested positive for mixed connective tissue. So having this toxin in my body, and specifically the trichocethine group is what presented high. I am frustrated and I don't know what to do. I feel like my body is slipping away due to all these elements, and I need to turn my ship around. You're brilliant, and I would be grateful for any help. Thank you. Okay. So, Amanda, let me make a comment. Comments. I'll see what I can add here. So, first of all, when somebody gets hair loss, we need to eat, whether they have mold toxins, whether they have Lyme, whatever they have, there's some basic steps we need to do. Any doctor should do regardless. And this is, if you go to your family doctor, this is what they should do. Okay. So the basic steps you do for anyone with hair loss is check your thyroid with a TSH, a free T4, and a free T3. Make sure you got normal thyroid levels. Okay. excessive amounts of thyroid can lead to hair loss. Okay. Number 2, check iron. And by measuring a chemical in your blood called ferritin. Ferritin is the storage form of iron. And if you have low iron, a low storage form of iron that is 20 or lower, above 40 would be good, but 40 or lower, excuse me. Anything over 40 is good, really good. You would not have hair loss from low iron, but if it's under 40 for your ferritin levels, that indicates low iron stores, and that can lead to hair loss too. Okay, so first step is check those out. Okay, all right. Second thing, one of the binders that we tend to use for mold toxins is activated charcoal. And activated charcoal can also pull minerals out of the body that are essential for hair growth, okay? So over time, I've come to learn that when I use activated charcoal, I have to be careful when people start getting into hair loss to try to replace minerals that might be being pulled out by the activated charcoal. So I will put people on core minerals, and I will use a product by Research Nutritionals called Core Minerals, 2 pills 2 times a day. I will use that sometimes while continuing using the activated charcoal, but if somebody's got massive hair loss, I'm usually going to stop the activated charcoal and find some other binders I can use and not use activated charcoal. And while I'm still putting all these minerals back into a person too. Okay, so one big comment, because you mentioned it a number of times, is the hair loss is make sure you check thyroid, make sure your doctors have looked at ferritin levels, and also talk with your providers about possibly doing mineral replacement if you have been using activated charcoal as one of your binders. Talk to your providers about whether maybe you should be on different binders. Okay. All right. Now, to say what else to do here, I need to know a lot. You wrote a lot, but I would need to ask you lots of questions to try to figure out what you've tried, what's a priority for you next. The only thing I can really say at this point is you still have a great chance of getting better. Your doctors need to figure out how to weave through this whole mess that you have, and that becomes hard. But there are ways to work through this. And so I don't know where else to point you at this point, other than to say that there's a lot of things that you could still try that would help you depending on what's been tried already and where you are in treatment. And I can't tell from what you wrote here. So the main help I can give you, though, is what to do about that hair loss, which is if you are, do the blood studies I talked about, and consider putting in minerals if you've been on activated charcoal. Okay? All right. Good luck to you. All right, let's see. Hello, Carter. Carter wants to know if I have any suggestion for heart palpitations. So the answer is, for heart palpitations, may have an underlying problem or they may be more of a sensation. So let me tell you what I mean by that. So heart palpitation means you feel your heart skipping around, okay? And that can either be because you actually have a heart rhythm problem, in which case it should show up on an EKG, or an extended EKG, which we call a Holter monitor, where you do it for like a week or 2 weeks at a time, for instance, okay? But sometimes, even when people have those Holter monitors on, they report feeling palpitations because you record this stuff, but there's no underlying electrical pattern, okay? In which case it's real. I mean, you feel this stuff going on, okay? But it's more of a sensation. Okay. All right. Now, if you have electrical feelings or electrical patterns that are causing that, there's an EKG change that shows you have an electrical pattern going on, talk with your doctors to find out, is there a medicine you should use for that? Okay. But I also will have people start on magnesium. Magnesium is a way of kind of making it so the heart muscles are not as irritable and they tend not to get these skip beats. And the magnesium I would wind up using is either magnesium citrate or magnesium malate, about 400, 600 milligrams at bedtime. Sometimes it can help, not always, okay? For the sensations of palpitations, I find if there's things you can do to help calm relax, do things like meditation, exercise. Those are things that can often be helpful, although I know in Lyme it's sometimes hard to exercise. I get that. But those are the things that can help as well, too. Okay. Now, the magnesium I was telling you about, be careful. You get up around 400, 600 milligrams at nighttime before you go to bed. Makes you sleepy. That's why I have you take it at night, or I have my patients take it at night. But be aware when you get into that dosing range that sometimes you can get loose stools from it. Okay. All right. And if you do, you just need to back it down a little bit. All right. So first of all, work with your doctors to figure out do you have an electrical problem, or is this more of a sensation? Okay. If it's an electrical problem, talk with them about whether you should be on medications for it. And if not, give magnesium a try. Okay. All right. Good luck to you. Let's see. Hello, TJ. Any suggestions for hiatal hernia? Is that common with Lyme? So hiatal hernia is common in people without Lyme, and I tend not to see it occur any more often when somebody has Lyme than in people that don't have Lyme. Okay. So the one thing that we've got to be careful. This is just I'm going to give a commentary now. So my commentary is we have to be careful when we treat. I have to be careful when I treat somebody with Lyme, and doctors that treat people with Lyme have to be careful that we don't see everything as Lyme. All right. Because people with Lyme get other conditions. So or get common conditions. Okay. So we got to be careful not to put on what I call the Lyme blinders and see everything as Lyme. All right. So when people develop problems and they have Lyme disease, we need to make sure it isn't something else, or we have to consider that it's not something else. Okay. Just having a positive Lyme test and having symptoms that say Lyme disease doesn't mean it's not something else. Okay. So your doctors should be looking to make sure that you don't get common things as well, too. Okay. All right. Thanks for that question. Hello, Robert. Let's see. Hi, Dr. Ross. Thank you for sharing your wisdom. You're welcome. See, do Lyme persisters replicate when they go active? If so, are the new bugs also prone to be persisters? Good question. So let me just a brief conversation to make sure we're all on the same page about what persisters are. So Lyme has the ability to has two growth states. Okay, so one is a growth phase where the germ is growing, and there's another one where the germ is hibernating, or we call those persisters. And basically, hibernators have slowed their metabolism way down, and they basically ignore the standard antibiotics we throw at them. Okay, when they wake back up, they go back into growth phases. All right, now they don't. My understanding of this is that germs that have been in that growth phase, persister phase, that then become growth phase, behave like anything in growth phase. So they have equal chances of turning into persisters or not turning into persisters. Okay. I don't think it makes it an any different risk of it, basically. All right. All right. Thanks for the question. Good question. Hello, Michael. Let's see. Hi, Dr. Marty. Thank you for doing what you do. You're welcome. I have two questions for you. One, could you comment on the difference between cholestyramine and cholesevelam? And two, do you have any experience with oral bovine immunoglobulin? All right, bear with me here a minute. I actually don't use the cholesevelam, but I'm going to look it up here real quick. I'm just looking at my drug directory here, so bear with me just a minute. They both are, so cholestyramine and the cholecystolam are known as bile acid binders. Okay, so bile, your gallbladder makes bile acid, and or bile. The purpose of bile is it's supposed to go out in the intestines and mix in with fats to help improve their absorption. But they both will bind up the bile acids. I don't know whether cholecystolam is a useful for treating mold toxicity, which is where I will use cholestyramine, for instance. So I don't know. I haven't worked with it before enough to know. All right. Let me look at one other thing here real quick. And actually, I need to see, that's the generic cholecystolam. Oh, Welcall. All right, I know the drug. I had to say that's the generic. So the brand is called Welcall. So Welcall will actually work as well as the cholestyramine, and I find them to be interchangeable. Actually, okay. I'm sorry about that. I would usually call it Welcall, and it's just that the cholecystolam is in a pill, and the cholestyramine is a powder. Sometimes working with the cholecystolam, which is Welcall, is going to be easier to do, basically. Okay. All right. All right. Let's see. Number 2, do you have any experience with oral bovine immunoglobulin? I don't. I actually, so first of all, so you would use immunoglobulins if you tend to have low immunoglobulin levels or antibody levels, IgG antibody levels. And in terms of doing it orally, I'm not sure how effective it is. I honestly don't know. Okay. All right. Thanks for that question, Michael. Hello, SK. Have you tried bromelain to help clear out the spike protein? No, I haven't. From what I understand at this point, we don't really know how to get it cleared up. All right. So anyhow, if you happen to have some information about bromelain, I'd be glad to take a look at it where you're hearing about it, because I haven't really seen any information on that. Okay. Thanks, SK. All right. Let's see. So this is actually my last question tonight. We had oops, I guess not. Melissa just wrote a question. Anyhow, what I was going to say to people is we've got about another half hour here. If you still have other questions, feel free to write them. We have, because it's the holiday season, we're having a little bit of a lower sign up than typical, which may mean we have less people here. In fact, I don't even know how many people we have here tonight. Yeah, we have a lower turnout tonight than typical. And we had a smaller number of people registered than typical too, but it's the holiday season. So feel free to write your questions. We'll see how many more I can get through here, okay? So, all right, here we go. Let's see. Hi, Marley. Let's see. Dr. Marty Ross, thank you for your dedication as a doctor. You're welcome. Let's see. Could you please comment on high blood pressure and Lyme? I have been on an ACE inhibitor, which I was able to decrease with the protocol I was doing, but then COVID struck. Since having it, it has been difficult to control blood pressure. So could you comment on the effects of COVID on Lyme? Thank you. So regarding Lyme and blood pressure, it's interesting. I have not seen any description of how Lyme would influence high blood pressure. I'm not aware of how it would. However, I have a couple of my patients that whenever their Lyme is under good control, their blood pressure is good. And when their Lyme is not under good control, their blood pressure gets worse. And that's just what we see. I do not understand why that happens. But I want to reflect that, yeah, it's valid to think that maybe if Lyme is more active, that might be something that happens, because in clinical experience, I've seen it happen a couple times. Okay. All right. In terms of the effect of COVID on Lyme, I don't think we really know. The big thing I would say is that it gets confusing to tell what's what sometimes, all right? Because both COVID and Lyme trigger cytokine excess, right? So you've heard me talk numerous times in these webinars about cytokines producing most of your Lyme symptoms, right? So increase cytokines, make it so you can't sleep, make it so you can't think, make you hurt all over, give you fatigue, interfere with how your hormonal systems work, etc., right? Guess what COVID does? Same thing. Creates a syndrome of cytokine excess. Okay. So in terms of how I look at it, is it gets to be hard to differentiate what's Lyme and what's COVID or post-COVID. All right. It gets hard to differentiate that at times. Okay. All right. Thanks for that question, Marlene. All right. Hello, Melissa. Let's see here. I wonder what I'm still battling that may cause my ongoing symptoms. Exercise must be kept to low impact, if any. Additionally, stress or temperature change are issues that can cause jerking, convulsions, which seem to stem mainly from my core or arms, but oftentimes makes my head jerk back too. I am always fully awake and capable. Sometimes it comes on without any warning, and other times I may feel a bit odd or nauseous right before it happens. I may also experience what seems like reflex bursts of inhaling at the same time as the jerking convulsions, but I wouldn't consider it air hunger. In your experience, does this seem more Lyme, Bartonella, or Rickettsia related, or perhaps permanent nerve damage? IGenex in 2020 showed Borrelia burgdorferi, ELISA was 80, the Lyme immunoblot 18 positive. So, your Lyme immunoblot I would not call a positive test. The Rickettsia, slightly elevated. Yeah. So, when I see something that has a convulsion or a neurologic irritability type of syndrome, I tend to think more Bartonella, to be honest with you. And I know you haven't been tested for it here, but the things I would look back at are Bartonella symptoms. Okay, so Bartonella symptoms can be pain on the soles of the feet. We tend to have a lot of neuropsych issues that happen in people with Bartonella. So anxiety, depression, for instance, that seem to be more than you might expect from just having a bad illness. All right. Tremors and shakes. Light, sound, touch sensitivities, hypersensitivities, tremors and shakiness, atypical convulsions that would not show up on an EEG, but people clearly have something that goes on. Air hunger can sometimes be part of Bartonella, and how we think that happens is Bartonella can form deposits along with fibrin and blood-clotting protein on your blood vessel walls, and it literally narrows the opening for blood flow. So it can make it more difficult to get adequate blood flow to your lungs, and you feel like you're just not getting in. So the body's perceiving not enough oxygen, and therefore you get these periods of air hunger. So just this general description that you wrote, I would be wondering about Bartonella. I would also have to ask you a lot more questions, but just from what you described there, I would wonder about Bartonella. Okay? All right. Good luck to you, Melissa. Hello, Haida. Let's see. Hi, I'm treating according to your protocol. I use cat's claw, banderol, Siddhacuta, hutania, liposomal oils, curcumin, ashwagandha. It really helps. I'm grateful to you. Good. Thanks for sharing. I appreciate that. I'm glad it's helping you too. That's why I put the stuff out there. But I don't understand why I can't fall asleep or wake up at night, because I feel under my skin someone is biting my feet when I'm not moving. I especially feel like someone is biting in the place where the tick bit. When I move, it gets better. What could it be? So that sensation, biting sensation, often means neurologic irritation, or it means neuropathy. Okay. One of the things that if you were my practice, you were my patient, I was seeing you, and I had a patient describe this that I might try it, and herbally that I might try is to do something called L-Theanine. And if you've looked at my protocol, you know that in the sleep section, I describe L-Theanine as something you can use to get to sleep. Well, the one thing that it does too, so L-Theanine, everyone, is a chemical that comes from green tea. And when we take it, it's non-caffeine. Okay, so when you have L-Theanine, when it gets absorbed into the body, up in the brain, a lot of it is converted over into a chemical called GABA. All right, so our brain has a type of receptor called a GABA benzodiazepine receptor, And things that attach to that receptor calm agitation of the nervous system, including neuropathy. All right. So, for instance, prescription medicines that bind to that site, something called gabapentin, which is Neurontin. Ambien, the sleep medicine Ambien binds to that site. Xanax, which is an anti-anxiety medicine, binds to that site. Okay. And L-Theanine does too. Or the GABA created from L-Theanine binds to that site as well too. All right. So L-Theanine can be useful for nerve pain. If you bind to those receptors, it decreases the transmission of nerve pain too. All right. So what you might try in a situation like this, or I would have my patient try in a situation like this, is to take the L-Theanine comes as a 100 milligram pill, and you can do anywhere from 200 to 600 milligrams at bedtime. And that might be something you want to take about 30 minutes before sleep, so that by the time you go to sleep, it's in your system adequate amounts. And maybe knowing how it works, that could help with this kind of neurologic biting. Wow, just burping here all of a sudden. But neurologic biting sensation might be helped by being on that L-Theanine. Okay? All right. Thanks for that question, Heidi. Good luck to you. I'm glad to hear you're doing better too. Hello, Jim. Hi, Dr. Ross. Of the herbal antimicrobials used in your practice, which one or ones seem most likely to promote yeast overgrowth, promote imbalanced gut flora, or otherwise have a negative influence on the microbiome? Also, are there herbal antimicrobials you use that you think have very little or no impact on the microbiome? Okay, so Jim, I don't have a specific, let me answer this. I may disappoint you in my answer. So when we compare herbal antibiotics to prescription antibiotics, hands down lead to more disturbance of the healthy gut microbiome and can lead to yeast production. Okay, now I know that Buhner, as in Buhner Herbs, I think Buhner, as in Buhner Herbs, has been known to say that he doesn't think you get intestinal disruption of the good microbiome when you're on herbal antibiotics. That's not been my experience, okay? My experience is that any of the herbal antibiotics can lead to yeast overgrowth. I am not able to differentiate which one of the various ones I use has a greater chance because I usually use them together, okay? So I can't do a distinction as you're suggesting I would do, okay? Now, of those, though, if we look at, as you know, I also recommend using essential oils to help with the persisters. And so your liposomal oregano, cinnamon, clove, those essential oils, although they can kill growing and persister Lyme and growing and persister Bartonella, essential oils kill yeast, okay? So probably of all the things I recommend, the ones that would have the least chance of leading to yeast overgrowth in the intestines would be the liposomal essential oils that I was just talking about. Okay. All right. Good luck to you, Jim. No, so having said that, I would tell you that herbally, I rarely find people on herbal antibiotics get yeast overgrowth, but periodically somebody will. Okay. All right. Thanks for the question. Good luck to you. Let's see. Hello, Joyce. Let's see. My question about EBV and thyroid in relation to Lyme symptoms was sparked by a sonogram test that showed nodules on my thyroid. All other organs screen look excellent, so these nodules concern me, and I would like to find out what is driving them. Thank you for anything you can add. I don't have any additional thoughts. I'm sorry to hear that, but yeah. I mean, I haven't seen any relationship between Lyme promoting thyroid nodules and EBV promoting thyroid nodules, okay? People with thyroid disease can get thyroid nodules, and it could even be something separate from tick-borne infection or something separate from viral infection as well, too, okay? All right. Good luck to you, Joyce. Hello, SK. Let's see. Is blurry vision and crawling sensations in the head more Bart than Lyme? If someone has all the thyroid symptoms you mentioned except the weight gain, would you still suspect low thyroid? Is beef liver a good way to raise ferritin? So beef liver, yes, it's a strong source of iron, would be a way to raise ferritin. When I'm trying to figure out clinically if somebody has low thyroid, I kind of get a sense of the whole picture. You don't have to have a yes answer to each one of those thyroid symptoms I mentioned. If you have enough of them, a good number of them, especially the cold intolerance and dry skin, I find those to kind of be good predictors. Then I would say you have low thyroid. Okay. And then let's see. Blurry vision, crawling sensations are neurologic sensations. I tend to think of Bartonella more than Lyme, although Lyme can do it too. Okay. All right. In other words, I think Bartonella has a greater chance of being the cause of those than Lyme, but Lyme can do it as well. Okay. All right. Thanks for that question, SK. Good luck to you. Hello, Lynn. Let's see. Part 2 of the question about Parkinson's. You said you don't know if it could be related to Lyme, but can you recommend any supplement to help prevent neurodegenerative disorders like Parkinson's, whether it's Lyme related or not? Also, you said it's better to test for Lyme and Bartonella while on herbal antibiotics, but is it possible the germs will go into hibernation in the presence of herbal antibiotics and be harder to detect? So whether the germs are in hibernation or growing, you're still going to get an antibody reaction. Okay, you're still going to get an antibody reaction, so it doesn't matter actually. My point of saying if you're on something that's killing the germs is that there's more parts, at least of the growing forms, that get released into the bloodstream that can then be detected and create an antibody reaction. Okay, all right. Let's see. In terms of things to promote brain health, all right. So, the one thing you want to do is make sure that what I advise anyone that's wanting to do things to promote brain health, if they're concerned that they might have a tendency towards Alzheimer's or Parkinson's or multiple sclerosis, anything like that, is to do things that promote brain health. Number 1, exercise. Okay, it's a good thing to do. Number 2, do brain games. Do something that stimulates brain action. All right. Number 3, make sure you're not living in toxins. Okay, so test for mold toxicity. See if you've got mold toxins in you. Make sure you don't have mold in your home. Take a look at the chemicals that you're being exposed to in your home. Are they things that are known to be neurotoxic? If so, change your cleaning ingredients, for instance. Okay. Look to make sure you don't have tick-borne illnesses because they can lead to neurodegeneration. So do testing for tick-borne illnesses. All right. So those are some of my general approaches. The other thing that can be really helpful is to elevate a chemical in the brain called brain-derived neurotrophic growth factor, BDNF. All right. One way to do that is to be on Mariva 500. Curcumin can help with that, 500 milligrams 3 times a day. There is a research nutritionals product called BDNF factor, I believe, that might help promote that as well too. But those would be some things I would consider doing. Okay, I'm just speaking off the top of my head. Okay, all right. Good luck to you, Lynn. Oh, get sleep. 7 to 9 hours sleep a night. One of the best things you can do. Also, be on a plant-based diet. Plant-based diets tend to be low inflammatory, and which you want to keep body inflammation down to promote brain health as well too. Okay, all right. Hello, Diane. Let's see. Can Bartonella be passed in utero? Thank you. There have not been any studies that show it can be, but there is another, and I'm going to blank on the name of it right now. There is another infection similar to Bartonella that we know can be, so therefore we wonder if Bartonella is. There is anecdotal reports where doctors have taken care of a mom with Bartonella, and during the pregnancy, after the pregnancy, the baby gets Bartonella, so we wonder, but we don't have solid proof that it actually is. Okay, all right. Thanks for the question, Diana. Hello, Nick. I would like to know about porphyria and Lyme. I have learned that high porphyrins are extremely painful. I take cimetidine to hopefully help keep at bay. So I know that Dr. Dietrich Klinghardt out here in the Seattle area promotes the idea that we should look for porphyria in everyone. I tend to find low incidence of it, to be quite honest with it. You can do urine studies to see if you have the porphyrins in your urine or KPU in your urine. That's how I would do it. I would start by doing urine studies to see if you might have it before assuming you have it. Okay? All right. Thanks for the question, Nick. Good luck to you. Show this to everyone here. All right. So SK, thank you for providing me information about bromelain. I'll have to take a look at this. But everyone, if you're interested, I just posted on the screen the link to the bromelain article at the NIH. Actually, let me just do this. I wonder, so that this actually shows up in the recorded version. Bear with me here. I'm actually going to go there. And I'll do a screen share on that. So let's see here. I think I'll do a screen share on that. Oh, let's see here. Let me do a screen share now. Oops, where did it go? Huh. Oh, wait a minute. Maybe let's try here. There it is. So this is the article that you were just telling me about. Bromelain inhibits SARS-CoV-2 infection via targeting ACE2 and spike protein. So I'll take a look at this later, but I wanted to post this up here so the people that could see this article and go view it themselves. Okay, so let me go back here. All right. Thank you, SK. Hello, Charles. How often should you retest for mold mycotoxins with urine test? I had pretty high levels. After 4 months on mold call, I finally passed the VCS test. Yeah, I'm usually going to do it about every 4 to 6 months. That tends to be how I work in my practice. Okay. All right. Good luck to you, Charles. Thank you. Hello, Melissa. Let's see. Additionally, when I lay down to sleep, may drift off, but within minutes, wake to an episode that could last a few minutes to off and on most of the night. I've continually had burning electrical pulsing in feet and legs, migrating muscle twitching, and sharp pains throughout, as well as creepy, crawly sensations in head, shoulders, and arms. Although all those later symptoms are far minimal at this point, they still persist. What are these symptoms usually? Okay, so these kind of symptoms you're describing, I tend to think of Bartonella. And I think, Melissa, from your previous question, you're on the Hutania psittacuta, so you're gradually working on those, okay? And I cannot remember from your earlier post question as to whether you're also doing something for persister forms of Lyme and Bartonella. As you know, in my current version of the protocol, I'm now recommending that people use liposomal cinnamon clove oregano oil essentials by Dr. Inspired Formulations, 1 capsule twice a day, because that will go after your persisters. It goes after growing forms as well, too. So if you're not doing that, you might consider adding that in, or people should consider adding that in, okay? But the L-Theanine I mentioned earlier may help with some of these neurologic sensations you're getting to, okay? All right. Good luck to you, Melissa. Hello, Kate. Let's see. Do you ever see lymphoid hyperplasia in people's throats? What to do? Also, is muscle tension in and around the head common post-Lyme from stress? I think it's constituting or contributing to my eustachian tube dysfunction. Insight is appreciated. So I have not seen lymphoid hyperplasia in my patients, so I don't know how to comment to that. Muscle tension, when you get Lyme, an area that's common is to have pain and tension back here in the neck and the shoulders. Sometimes even when we get people well, there's areas that have been injured that just still remain problematic. And so I just want to point that out. What I like to do for that kind of muscle tension and stress is be on anti-inflammatories like a curcumin I mentioned earlier, 500 milligrams 3 times a day. Magnesium's good. If you can do 400, 600 milligrams at bedtime, sometimes that can help to relax that area as well too. Okay? All right. All right, everyone, that's it. I now have gone through all your questions again a second time. And I think we'll call it quits for tonight. So thanks for hanging in with me the whole time. We made it through about an hour and 20 minutes tonight. And so if you get benefit here tonight, let people know. We're going to be doing another one next week, and we'll do another one the week after that. At least that's what my intention is at this point. I know it's holiday season, so sometimes people are going to be out doing other things. I get that. But share this information so people can get help like you're getting help here tonight too. Tomorrow morning, you'll get an email from me in which I will summarize the general topics we talked about tonight, and I'll give you a link to where that recording actually is. And in addition, you'll get a link to sign up for next week's webinar as well too. Okay. All right. Good to be here with everyone tonight. And I wish everyone a good week. All right. Good night, everyone.